Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. Today we will cover a medication called famotidine, also known as Pepcid, which is part of the drug class of medications called histamine 2 antagonists. Famotidine was first approved by the FDA in 1986 for the treatment of Pepcid ulcers and gastroesophageal reflux disease, commonly abbreviated as GERD, and has been on the market for nearly 4 decades. Let's discuss how famotidine works and which conditions it's used for. As mentioned, famotidine is a medication that belongs to a class of medications called H2 blockers or antagonists. It works by blocking the action of histamine on specific receptors in your stomach and reducing the production of stomach acid. Keep in mind that histamine is a substance that stimulates the production of stomach acid. This reduction in stomach acid allows the lining of your stomach and esophagus to heal and prevents further damage from acid-related conditions. However, some treatment guidelines actually recommend another type of drug class of medications known as proton pump inhibitors, commonly abbreviated as PPIs, over famotidine for people diagnosed with erosive esophagitis. This recommendation actually comes from research indicating that those using PPIs experience quicker healing and greater alleviation of heartburn symptoms compared to those using famotidine. H2 antagonists remain very important in heartburn treatment as they have demonstrated effectiveness in numerous studies. Let's now move on to dosing and administration. Over-the-counter famotidine is available in tablet form in 10 mg and 20 mg strengths and is used for short-term prevention, treatment, or relief of heartburn or GERD. Prescription famotidine is available in tablet form in 20 mg and 40 mg strengths and is also available as a liquid suspension. Famotidine can be prescribed for various conditions such as gastric ulcers, which are sores in the stomach lining caused by stomach acid, and duodenal ulcers, which are similar sores but occur in the upper part of the small intestine called the duodenum. Heartburn or GERD, which occurs when stomach acid flows back into the food pipe, causing a burning sensation in your chest. Erosive esophagitis due to GERD, which is when the lining of the food pipe gets damaged by stomach acid, leading to inflammation and sometimes ulcers. And Zollinger-Ellison syndrome, which is a rare digestive disorder that results in too much gastric acid. Famotidine can be taken by mouth with or without food. However, if it's upsetting your stomach, try taking it with food to help. Keep in mind that this medication may start working within 1 hour of administration and continue to provide relief for several hours after. However, if you find that famotidine by itself is not sufficiently relieving your heartburn symptoms, consider discussing with your healthcare provider the option of combining it with an antacid such as Tums or a proton pump inhibitor such as omeprazole for effective relief. If you do forget to take a dose, take it as soon as you remember. However, if it's almost time for your next scheduled dose, it's best to skip the missed dose and continue with your regular dosing schedule. It is, however, important to avoid doubling doses to make up for the missed one. Like all medications, famotidine has a few side effects. Some common side effects may include diarrhea or constipation, nausea, vomiting, upset stomach, dry mouth, dizziness, fatigue, fever, dry skin, or headache. So if you are experiencing any of these side effects, be sure to talk with your healthcare provider to determine whether a dose adjustment or switching to a different medication would be beneficial for you. While famotidine is generally well tolerated, like any medication, it can cause serious side effects in some. It is important to be aware of these potential risks and to receive medical attention immediately if any serious side effects occur, including allergic reactions such as a rash, itching, swelling of the face, lips, tongue, or throat, or severe dizziness or difficulty breathing, confusion or hallucinations or changes in mood or behavior, severe stomach pain or cramping. This could be a sign of a more serious condition and should be evaluated by a healthcare professional. Kidney problems. You may experience changes in urine output, swelling of the ankles or feet, or persistent fatigue. It is important to note that serious side effects with famotidine are relatively rare, and most patients tolerate this medication well. However, as mentioned, if any concerning symptoms occur while taking famotidine, it is important to receive medical attention immediately. Additionally, those with pre-existing medical conditions or those taking other medications should discuss the potential risks and benefit of famotidine with their doctor before starting treatment. Famotidine has the potential to interact with numerous medications, especially those requiring an acidic stomach environment for optimal absorption into your body. Medications that could increase your risk of certain side effects when taken with famotidine include antiviral medications used for HIV, such as fosemprenavir, or muscle relaxers, such as tizanidine. Before starting famotidine treatment, make sure to inform your healthcare provider about all medications. Avoid starting any new medications while taking famotidine without consulting with your provider or pharmacist first, as they will assess the safety of all medications for you. So to briefly summarize what we discussed today, famotidine, also known as Pepcid, is a histamine 2 antagonist medication used to reduce stomach acid. This medication helps block histamine 2 receptors, decreasing stomach acid and helping heal stomach and esophageal linings. Over-the-counter famotidine treats heartburn relief, while prescription strength is used for ulcers, GERD, erosive esophagitis, and Zollinger-Ellison syndrome. Dosage varies by condition, typically taken by mouth with or without food, with effects starting within an hour and lasting several hours. Combining this medication with an antacid or PPIs can enhance relief. Common side effects include gastrointestinal discomfort, dizziness, and headache. Serious side effects, though rare, include allergic reactions, confusion, severe stomach pain, and kidney problems. You should discuss risks and benefit with your doctor, disclose all medications to avoid interactions, and receive medical attention for concerning symptoms. You can read more about heartburn, GERD, or Zollinger-Ellison syndrome on our website, so check those articles out in the links below. If you have any questions about famotidine, antacids, or TUMS, omeprazole, or other PPIs, be sure to talk with your doctor or leave them in the comment section below. And don't forget to subscribe. Bye for now.